South Africa is one of the most diverse and culturally rich countries in the world. It has an extremely well-developed economy, producing 90% of the world's platinum and around 41% of the world's gold. These precious metals help make South Africa's economy very stable. However, other issues plague South Africa. One such issue is South Africa's chronic problem of abuse and acts of sexual violence. It is shocking to see that 1 in 2 women between the ages of 18 and 49 had experienced some form of sexual violence in South Africa, while 1 in 4 South African women have been raped in their lifetime. South Africa is overwhelmed by some of the world's worst known figures of gender-based violence for a country not at war. It goes without saying that the high rate of rape indeed fuels the HIV/AIDS pandemic. Anti-sexual violence activism in South Africa, or ASVASA for short, is our organization that helps to make society in South Africa safer for South African citizens, especially young women, by bringing them aid in fighting the battle against sexual violence. ASVASA is a nonprofit organization with a mission to mitigate the prevalence of sexually transmitted diseases while minimizing the rates of sexual violence by providing direct aid in microcosmic communities in South Africa. Our vision is that South Africa will no longer be tied to sexual violence, so it can celebrate its successes without being tied down with this negative connotation.
There has been little research regarding the psychological impacts of sexual violence on South African women. As a result, the psychiatric needs of these women who have been victims of sexual assault have rarely been met. There is evidence that traumatic stress has major psychological effects on victims who could develop PTSD, phobias, depression, sleep problems, and/or substance abuse habits because of their trauma. We aim to create a center that will focus on the psychological health of sexual assault victims in South Africa. The center would provide psychiatric care as well as women's support groups to build a community around the victim. Our overarching goal is that South African women will find the center to be a safe place to find shelter from their trauma and perhaps be more encouraged to report their assault. When it comes to reporting their assault, many South African women fear that they will be humiliated, blamed, or reprimanded if they were to do so. To mitigate this risk, our psychological center will be equipped with well-armed security for the protection of clients. We would also appeal to community leaders in an effort to convince their respective communities that we're working towards a greater good. This would go a long way in convincing hidden sexual assault victims that they will not be ostracized just by being seen at the center, and that what is being done at the center is accepted within the community. To measure the success of our center, we will rely on the gross number of women who use the center weekly. If the number of women in the center goes up, the rate of success will be measured accordingly. We will also take into account returning patients as a measure of efficacy.
In a 2008 UN AIDS report, it is estimated that 5.7 million people in South Africa are living with HIV. Sexually transmitted infections, or STIs, contribute largely to the burden of health in South Africa and are recognized as major contributors to the HIV epidemic. To improve the care of these individuals affected by STIs, we are hoping to mitigate the effects of sexual violence by adding medical care to our objectives and improving the lives of South Africans. This medical treatment will take place at our health center and will be included as an option alongside psychological care. People who come into the clinic will be screened for STIs, and depending on the results of those tests, care will be administered from there by hired physicians. A list of services will be displayed to help inform clients of the clinic's services. These include emergency contraception, HIV testing, vaccinations against tetanus and hepatitis B, and antibiotics for sexually transmitted diseases. Screening can be expensive, however, which may cause individuals to not seek treatment because of costs. A way we plan to mitigate this risk is to make screenings free of charge so that people can identify their medical issues without having to worry about finances. It will be easy and quick to get the screenings done, and the ease and lack of cost will attract people to come and be educated about the health dangers that could be a concern to them. Similar to our first objective, our indicator of success will be the number of people using the center, which will let us know how popular and well accepted the program is. Another indicator we plan to use will be the lower disease rates in our community.
Sexual violence and disease control cannot be achieved by means of clinical interventions alone. Control and treatment of sexually transmitted disease remains an important public health priority for HIV prevention and should include a combination of prevention efforts such as extensive health education, condom promotion, and HIV and STI testing in all patient encounters. To make this a part of our program, we will have advertising campaigns with posters and pamphlets to be distributed in community centers to raise awareness about the serious potential health and psychological consequences of sexual violence, and how illness such as STIs can be prevented or reduced with timely access to proper health care. Sexual violence against women is often strongly influenced by cultural factors and values. Because of this, it may be difficult to change the stigma around sexual violence in South Africa because of its deep roots in societal standards. A way to mitigate this is education. This education can be provided in our centers and in advertisements that promote countercultural ideas about what it means to practice safe sex and receiving aid in cases of sexual violence. STIs are a reliable marker of HIV transmission that should be monitored to assess the effectiveness of these combined prevention efforts. Feasible methods such as case reporting and periodic surveys can identify areas where STI control is poor and provide the data needed to monitor the program's performance.
ASVASA's vision and objectives can be implemented within a 5-year time span with appropriate funding. The overall plan is to eliminate the abundance of sexual violence and sexually transmitted illnesses in the South African community. Within the next year or so, the center itself can be constructed with an office building, medical facility, and therapeutic center. The center will be a home base for project planning done by advertising, healthcare, and psychology professionals. Once the center is complete, we will invite the community to make the center a home for the victims of sexual assault, individuals interested in promoting community health, and those who want to help prevent sexual violence. ASVASA will join forces with local public health agencies and providers as well as community leaders to share services and make the campaign against sexual violence and sexually transmitted diseases a nationwide movement. In the end, our mission to administer our service to the microcosms of South Africa will spread and make the vision one shared by all of South Africa.